Hi, class. In this next video, we're going to look at the plexi of the lower back, which will go to the lower extremity. Remember, in terms of plexi, there's two in the neck, a cervical plexus and a brachial plexus. And there's nothing in the mid-back. There's no thoracic plexus. It's just intercostal nerves. And then in the lower back, we have this lumbar plexus right here. And then we also have a sacral plexus here, right? And I'll let you know if there's any important nerves that we need to be familiar with here. So in the lumbar plexus, remember all plexi stem from which rami? You got to think dorsal rami or ventral rami. And all rami stem from the ventral. All plexi, I should say, sorry about that. All plexi, whether it's cervical plexus, brachial plexus, lumbar, or sacral, all come from the ventral rami, which are motor. Dorsal rami is sensory. So here it's the ventral rami of L1 to L4. And that's going to go and supply the abdominal wall, the external genitalia, and the front and the inside of the thigh. When there's the two big nerves that come off that lumbar plexus are the femoral nerve and the obturator nerve. When there is damage to the femoral nerve, there's going to be the inability to extend the leg. Why is that? Well, that's because the femoral nerve goes to your quadricep muscles. Give me a second. So the femoral nerve goes to your quads. What are the quads? Well, you remember what the quads are. It's the rectus femoris, the vastus sisters, the vastus medialis, lateralis, and intermedius. Okay? If there is damage to the sensory part, and the sensory part is called the lateral femoral cutaneous nerve, then there's going to be loss of sensation to the front of the thigh. The other big nerve is the obturator nerve, and the obturator goes to the inner thigh. And when you think of muscles of the inner thigh, we're thinking adductors. Adductor longus, adductor magnus, adductor brevis. So here is the lumbar plexus, and we can see pretty much L1 through L4. And the femoral nerve and the obturator nerve are two of the biggies that come off of it. But this one's also interesting, that lateral femoral cutaneous nerve. When this one is compressed, it's compressed primarily if someone's wearing a tight belt or tight pants or pregnant, or they're a police officer that has the belt with, let's say, the nightstick, the gun, all of that stuff around the waist that can put pressure on the lateral femoral cutaneous nerve. If it's a contractor that's wearing a belt with all their tools hanging from it. So anything that can create this constriction right around the waist, whether it's a big belly, if someone's obese, if someone's pregnant, if it's tight belt, tight jeans, tight pants, police officer, anything that can create that compression of the lateral femoral cutaneous nerve. The condition, see if I can get my pen to work here, is called meralgia. Meralgia with an M, meralgia paresthetica. Meralgia paresthetica, which paresthetica sounds like the word paresthesia. And paresthesia means abnormal sensation, like pins and needles. That's a type of paresthesia. Going to the dentist and your face is numb, right? That's a type of paresthesia. So neuralgia paresthetica is the compression of that lateral femoral cutaneous nerve, which creates numbness and tingling to the front, to the anterior lateral part of the thigh, right? It's not the back. Usually the back of the thigh is a sciatica. This is neuralgia paresthetica. It's different. Okay, let's look at the sacral plexus. So the sacral plexus is from L4 to S4. Lumbar plexus, remember, was L1 to L4, and the L4 is shared. It's shared with the sacral plexus. Again, ventral rami, and this one is anterior to the sacrum. You can see that it goes anterior to the sacrum, and it's going to supply pretty much the buttocks, all of the lower limb. It's going to supply most of the posterior thigh, the posterior leg, the bottom of the foot. I want to show you that. So here is the sacral plexus. And the infamous nerve right here is called the sciatic nerve. And it's really made up of two nerves. I'll show you the two nerves that it's made up of. One of them is called the common peroneal, and the other is called the tibial. Common peroneal and tibial, those make up the sciatic nerve. Okay. So right here, I like this picture better because we can see the sciatic nerve. You could see it's the largest, thickest nerve in the body. We can see the two different tones of green here, and we can see that it's made up of the tibial nerve and the common peroneal nerve. Now, there are a bunch of other nerves coming off of the sacral plexus, but these two are probably the most important, okay, that I want you to know. Now, on this picture, what I want you to see is on the left-hand side is anterior, and on the right-hand side, it's showing the posterior. So let's focus on the sciatic nerve. You could see it on the anterior right here, but then it kind of disappears, right? You can see the color changes. So let's go to the posterior. Here's the sciatic nerve. It comes down, and then look what happens. Right at the back of the knee, it splits. It splits into a tibial nerve and a common peroneal nerve. Well, where did we hear those before? We heard that the sciatic nerve is made up of two nerves, the tibial and the common peroneal. So we can see this is where it splits into those two branches. Tibial stays as tibial, right? It goes right down the back of the tibia. This is all tibial, tibial, tibial. It goes right down the back of the calcaneus, and then it splits and goes underneath the foot to the plantar surface of the foot. One goes to the medial plantar surface, and the other goes to the lateral plantar surface. So guess what we name it? A medial plantar nerve and a lateral plantar nerve. And this is why when people get sciatica, which just means an irritation to the pathway of the sciatic nerve, some people get the pain radiating just to where the buttocks are. Some get it down the back of the hamstrings. Some have it from the glutes, down the hamstrings, down the calf, all the way down to the bottom of the foot. Or some people, it skips all of this and just goes to the foot. Or some people, it skips here and just goes to the back of the calf. the representation can change from person to person. But I want you to see how the sciatic nerve comes from the sacral plexus, goes under that greater sciatic and lesser sciatic notch that you learned when you did osteology, goes down the back of the thigh, and right where that popliteal fossa is at the back of the knee, it splits into a tibial, and I'll change the color of the other one, and a common peroneal. Now, whenever you hear the word common, whether it's in neurology or whether it's in the blood vessels, whenever you hear the word common, it's safe to assume that that structure is going to fork. So in the neck, we have a common carotid artery. There's the word common carotid. It will split into two other arteries, an internal and external. Okay. In the groin area, we have another large blood vessel called the common iliacs. There's the word common. So there'll be an internal iliac and an external iliac. So here, neurology, we talk about common peroneal. So where there's the word common, it's going to divide. And I'll change the color again. We'll turn this black here. We have one that stays out here, and then one that goes this way. The one that stays outside superficially is the superficial peroneal nerve. And the one that goes right here between the tibia and the fibula, it then comes here to the front. And it goes to all of the anterior compartment muscles of the leg. That's called the deep peroneal. So the common peroneal divides into a deep peroneal and a superficial peroneal. The superficial peroneal stays superficial. This is the one, if you ever sit with your legs crossed and your toes go numb, it's because that superficial peroneal is being compressed right at that head of the fibula when your legs are crossed in like a figure 4. The deep peroneal goes deep and goes to all of these anterior compartment muscles, all of the dorsiflexors. So all of your dorsiflexors, all of the dorsiflexors are innervated by the deep peroneal nerve. So if there's damage to this deep peroneal nerve, you won't be able to dorsiflex the foot. Like you won't be able to do heel strike, part of the gait cycle. If you can't dorsiflex, that means your foot drops. So you get a condition that's called foot drop. You'll get a condition that's called foot drop. Foot drop is when there's damage to the deep peroneal nerve, weak dorsiflexors, then the foot drops. It just so happens that the deep peroneal nerve also originates at L4. So there's a little rhyme here that L4 controls your dorsiflexor, which we know is tibialis anterior. L4 controls your dorsiflexor, which we know is tibialis anterior. So if there's damage at the L4 nerve root in the lower back, maybe you have a misalignment, maybe you have a herniated disc or a bulging disc, that can create a foot drop condition. If there's weakness to the tibialis anterior, Maybe the dorsiflexors are weak because the deep peroneal nerve isn't sending the juice that it needs to there. But that deep peroneal nerve comes from the lower back at L4. Okay. Now, sciatica is like saying you have a headache. And there's different types of headaches, right? There's a tension headache, a migraine headache, a tumor headache, a hormonal headache, a caffeine headache, cluster headaches, dehydration headache, subluxation headaches, right? There's so many different types of headaches. And saying someone has sciatica, again, it's just telling you that the sciatic nerve is being irritated, but it's not telling you what's the cause. Is it coming from a herniated disc, a bulging disc? Is it coming from a spinal subluxation, which is a misalignment of a vertebra? Is it coming from an osteophyte? An osteo, which means bone, right? An osteophyte is a bone spur, right? People that have arthritis in their lower back get bone spurs. It's like a bony growth that can pinch a nerve. Piriformis syndrome. You guys learned about the piriformis muscle. Well, that piriformis muscle goes this way. It goes from the front of the sacrum and it goes like that right to the greater trochanter. So it's almost like a type of thoracic outlet syndrome, right? If you think of the concept of thoracic outlet, where it's either the scalenes or the pec minor compressing the brachial plexus, here we have a piriformis muscle that can compress the sciatic nerve. All right, so piriformis syndrome is a type of sciatica. You can have a tilted pelvis. You can have a pelvis that tilts, which changes the orientation of that greater sciatic notch, and that can pinch the sciatic nerve. You can even have a foot problem. You can have flat feet. You can have pes planus, which is flat feet. And yes, flat feet can work its way up to cause a sciatica. Okay. Okay, we'll take a pause here and then we'll get into some of the dermatomes.